As COVID-19 vaccination rates are beginning to flatline across the North Country, many are discussing the idea of vaccine hesitancy. Recent data released by the Center for Community Studies at Jefferson Community College in partnership with Syracuse University reported that nearly 1/4 of North Country adults are hesitant to receive the vaccine.
So 75% of the participants in the three-county region combined indicated that they have no vaccine hesitancy. It's that remaining 23 to 24% that if we are to reach the herd immunity, then there has to be some decisions made amongst that 24% to actually get vaccinated.
The study, led by JCC's Joel Lalone and Syracuse University epidemiologist David Larson, presented that vaccine hesitancy in the North Country is not a political issue. Factors such as fear of safety and lack of trust in government play a much larger role in such hesitancy.
The big thing is it's not a partisan issue. It's not a political issue, the vaccine. And so we need to make sure that we don't frame it as such. And so it's people have concerns about the necessity and the safety and the effectiveness, and that's what we need to address. And not try to make this a political fight.
I, for one, interpret this data as there are opportunities that are really educationally driven. Get the facts out about safety and the effectiveness and the necessity and the thoroughness of research and studying with the clinical trials that were done. And if we looked at effectiveness, take a look at other countries that haven't had the vaccine distribution that we have over the past month, where there's been explosions in numbers and there's been increases in variants, mutations that have surfaced. So I think that would be quite convincing to most people of the necessity.
But what caused these factors?
What drives those fears of safety and fears of effectiveness is a lack in the North Country is a distrust of government in general and distrust at times of agencies and formal groups that frankly tell, or at least in the opinions of North Country residents, tell them what to do.
To speak further to the necessity of the vaccine, Larson discussed recent evidence from an epidemiological perspective on its effectiveness.
And so our elders, our senior citizens in the country have been vaccinated at more quickly and at higher rates than our younger people, in part due to the prioritization. And the data from hospitalization is that our average age of hospitalized patients is going down. So younger people are more often hospitalized than older people. Over the next few months, we'll likely see coronavirus subside quite substantially due to the increase in temperatures, changes in behavior, the seasonality of the virus. But then in the fall, it'll come back, and it will particularly hit people without vaccines. And so we'll see hospitalizations of people without the vaccine.
And how to combat this hesitancy in the future, Lalone and Larson both focused on educational methods on a local level, steering away from incentives or restrictions, hoping to gain back the public's trust.
We would hope that this data would be one of many data points that are available to citizens right now to recognize that the vaccine is safe, effective, necessary, free, and it really is the social norm.
Well, the vaccines is more effective than anybody dreamed it would be. You know, it's beyond our wildest dreams effective. And it's the fastest way we can get our lives back, can get our society, our communities back to to be free again, basically.
I think about it in this way. I think about the science is irrefutable. That if we are going to reduce the likelihood of further mutations, if we're going to reduce the rate of transmission, if we're going to be positively impacting our health and our economy in the North Country, then this is the road to do it.
For ABC 50 Now in Watertown, I'm Isabella Colello.